The lymphatic system consists of lymph vessels and lymph nodes. The vessels are how the fluid from the limbs and organs get to the lymph nodes. Lymph node basins are located in your neck, armpits, abdomen, and groin. The lymphatic system plays a large role in immune function. This is how your body fights off disease, infection, and cancer. It also plays a large role in circulation. As fluid moves out of the tissues through the lymph vessels, waste products, bacteria, dead cells, and large proteins are collected. This is then moved into a lymph node where it is broken down and filtered. The protein-rich fluid that remains is then transported back into the circulatory system. Lymph nodes are also where white blood cells are produced. These are important in your immune function. Lymphedema is defined as swelling in one or more limbs. It can affect the trunk, chest, back, and abdomen. It could even affect your head, neck, face, breasts, or genitals. Fluid in the body's tissues is called interstitial fluid. Once it enters a lymphatic vessel, it becomes lymph fluid. Lymphedema occurs when the lymphatic vessels can no longer transport the lymphatic fluid back to the circulatory system. This protein-rich fluid builds up in the body's tissue and creates visible swelling over time. Proteins draw water to themselves, which makes the swelling worse as it pulls fluid from the circulatory system. Over time, if lymphedema is not treated, the swelling in the tissue will get worse and it will start to harden, which is called fibrosis. Lymphedema is considered a progressive, lifelong condition. It requires daily self-management to be kept under control. It's often a misdiagnosed or poorly managed condition. Early detection and treatment is key. The best practice guidelines have been developed for lymphedema management, and ongoing research is occurring to help improve treatments. At this present time, there is no cure. Symptoms can be managed with proper treatment, but in some cases, even with good treatment, the symptoms can progress and become difficult to manage. Let's review the different types of lymphedema. Primary lymphedema is when the lymphatic system is poorly developed or has lymph nodes or vessels that do not work properly. Milroy's disease or syndrome generally expresses itself at birth or in the very early years. Mage lymphedema, also known as lymphedema precox, generally begins sometime during puberty, while lymphedema tarda begins in or around middle age. There are also some vascular conditions that are associated with lymphedema, such as hemangioma, lymphangioma, and port wine stains. Secondary lymphedema is the most common form of lymphedema. It's acquired as a result of damage to the lymphatic system. The most common causes are surgery, radiation therapy, injury, and infection. Lymphedema can develop many years after a surgery or injury to the lymphatic system. It is currently understood that the lymphatic system cannot regrow to its initial capacity.